Are you someone with scoliosis and you're curious about what the scoliosis is causing in your body and what you can see and what is happening in the spine? Today I'm going to show you how I describe scoliosis with my patients on their first visit and how I describe how it's affecting their body and what they can see. I'm Dave Butler. Welcome to Align Therapy. Okay, so if we look at the spine, this is the description and the explanation that I give my patients on their first day at Align Therapy when we're working with them for scoliosis. This is scoliosis specific. Some things can translate to kyphosis as well. So if we look at someone from the side, we should see normal curves in the spine. We should see a lumbar curve that goes this way. We should see a thoracic curve that goes this way and a cervical curve that goes this way. So this is the front, this is the back. So that is what we should be seeing right there. That's normal, and we want that. Any excess or reduction in those curves is something that we want to address as well. So from the back, we should see a spine that is straight. So any curve that goes side to side like this, we call scoliosis. And scoliosis can be anywhere from the upper thoracic, even into the neck, into the thoracic part of the spine, in the lumbar part of the spine, anywhere along the spine we can have a scoliosis curve. What most people don't realize about scoliosis is it's a three-dimensional deformity, we call it. So we have this dimension from the side. We usually see a flattening of the spine called a hypokyphosis. From the back, we will see a curve in the spine, the scoliosis, the Cobb angle that we can see on an x-ray. And we also have a rotation associated with the curve. So if we have a curve that's rotating this way, we'll see a rotation that rotates this way. So a right curve will rotate towards the right in that area of the spine. What that causes, I wish I had ribs on this skeleton, but you can imagine ribs are here and here. So the ribs on the side here, as it rotates back, those ribs rotate back on that right side. And on the left side, they rotate forward. So most of the time when we're screening for scoliosis, we'll have someone do what's called an Adams forward bend test. And the Adams forward bend test is bending forward and then looking to see if we have a rotation by seeing if the ribs are higher here than here. And then in the lumbar spine, we don't have ribs, but these transverse processes will rotate as well. So we're looking to see if one side is higher than the other side. So that's the rotation component. And what a lot of times what people will notice with that, we have a rotation that pushes the ribs back on the right side, and we have the shoulder blade sitting right on top of the ribs. And because the ribs are pushing back, it actually pushes the shoulder blade back. But since the shoulder blade is attached at the top and isn't going to push away from that top attachment, it tips like this, and so we get more of a prominence on the shoulder blade on the side that's rotated back, usually with a thoracic curve. So that's why, you know, a lot of times like dance teachers or swimming instructors, or just when you're swimming and in a bathing suit, your parent or your teacher might see that your shoulder blades are uneven. And that's because of the rotation. It can be because of the scoliosis curve, but most of that is actually because of the rotation and how your shoulder blades sit differently. So those are some things that you might notice. Another thing with the rotation in the ribs, if it rotates, so I'm rotating it this way because that's the most common scoliosis curve that we see. The ribs on the right come back and the ribs on the left go forward. So we see a rib prominence on the right side, but on the front side we'll also see a rib prominence on the left side because the ribs rotate on the front as well. So that's something to keep in mind, that we have that rotation on the back and on the front. The last thing I want to go over is, usually when we have a curve, we have a pelvic imbalance. Not always. There are some curve patterns where we don't have that. But if we have a curve, so a lot of times the pelvis will shift away from that curve. And so the waistline looks different on one side versus the other. A lot of people think that that's a leg length difference, like one leg is higher than the other or longer. But most of the time, it's a shift in the pelvis where the pelvis is shifted out from underneath the trunk. Sometimes we do see a leg length difference, and that's definitely possible. But most of the time, we're seeing a waistline change that's because of the pelvis being shifted. In the Schroth method, we look at all these things and we put someone into a curve pattern. And those curve patterns are specific to where the scoliosis is and where the pelvis is, where the apex of the curve is, and where the transition points and things like that. It's very crucial to know the curve pattern of the person so that we can treat them according to that curve pattern. Because every curve is different, but Schroth method exercises are specific to a certain pattern of curve. And those are the exercises you do for that pattern of curve. So check out our other videos demonstrating Schroth method exercises, and you can kind of see some of the differences that we use with Schroth method training. I do not recommend you doing the Schroth method exercises in our videos. Please seek out a Schroth method provider, a physical therapist that does the Schroth method, so that they can train you on your specific curve. Hopefully this was helpful and you understand more about your spine and about the asymmetries and the three-dimensional nature of the scoliosis. And hopefully it helps you to get better treatment. The more informed you are about your back and your spine, the better able you are to get the right treatment for that. So I hope this was helpful. Thank you for watching. Don't forget to subscribe and check out the other video links in the description below. Thanks.